Hello, I'm Dr. Salos. Every medication has side effects. Furthermore, it can only be utilized if the effect is larger than the side effects. Few medicines are as contentious as statins when it comes to adverse effects. To begin with, there is no evidence that statins promote cancer or dementia, so we will leave it out of the discussion. I'm not even going to mention the liver. This is due to the fact that increased liver enzyme levels are usually transient and do not result in cirrhosis or liver cancer. And the first thing I will tell you about is clinical trials and observational studies. By laying this as a foundation, we can understand why the side effects of statins can be serious. Clinical trials are the most reliable source of medical evidence. This is due to the fact that cause and effect interactions are best expressed through rigorous design. However, utilizing clinical studies as the only basis has limits. To begin with, it is difficult to continue for an extended amount of time. Furthermore, there can be conflict of interest from the pharmaceutical business. It is especially crucial to note that clinical trials are prone to underestimating pharmacological adverse effects because they focus on the effect. So, I will provide both clinical trials and observational studies on statin adverse effects. The first side effect is muscle pain. This is a major side effect that is often severe and causes people to quit statins. What causes muscle pain? For starters, statins inhibit not only the creation of cholesterol, but also of coenzyme Q10, which is required for energy production. This might have a direct impact on the muscles and produce pain. Second, blocking cholesterol synthesis resulted in fewer structural proteins that make up muscle cell membranes. Pain frequency? 1 to 3 people out of 10
No!
is more than you realize. This is the outcome of an observational research. However, most clinical trials show that 1 in 100 persons experience muscle soreness. Statin supporters attribute this to the nocebo effect. This indicates that when taking drugs, unfavorable expectations induce actual adverse effects. But are all of these folks claiming to be ill due of the nocebo effect? Also, do you know what the clinical trial diagnostic criteria for muscle discomfort are? Pain is not the standard. It is only identified when creatine kinase, a muscle enzyme, rises 10 times higher than usual in a blood test. Menstrual cramps, headache. Is the diagnosis determined by a blood test? Muscle discomfort can occur even if muscle levels remain constant. Coenzyme Q10 supplements are occasionally prescribed to relieve muscle soreness, although this benefit has not been proven. Muscle discomfort is thought to be more common in women, younger people under the age of 65, and those who engage in more physical activity. Muscle pain is a side effect that is unrelated to life, but is related to quality of life. The second issue is diabetes. When statins are used in clinical studies, there is a 9% rise. It affects 1 out of every 1,000 persons who take statins each year. Furthermore, according to researchers, diabetes develops slightly in advance in patients with obesity or prediabetes who already have risk factors. Finally, they claim that there is no issue because it reduces the chance of cardiovascular death. However, when we look at observational research, the picture changes. Over the course of 5 years, diabetes was 2.2 times more likely in statin users. It is 3.3 times greater if taken for more than 2 years. This is far higher than the 9% seen in clinical trials. If the longer you take statins, the more likely you are to acquire diabetes. We need to pay more attention to the findings of 5 or 10-year observational studies. As a result, we urge that patients using statins have their blood sugar levels monitored on a regular basis. What mechanism does statins employ to cause diabetes? First, it lowers pancreatic insulin secretion and raises insulin resistance. This results in diabetes. Second, it interferes with insulin control in fat cells. GLUT4 is a typical glucose transporter found in adipose tissue. Statins slow down this transporter. Third, there are epigenetic alterations. Epigenetic inheritance refers to change in function that occurs without a change in genetic structure. mRNA affects fat and sugar metabolism. Statins can have negative epigenetic effects in this situation. If statins are associated with an increased risk of diabetes, they may also be associated with kidney disease. This is a third side effect. Let's look at the study that surveyed 40,000 residents of San Antonio, USA over 8 years. Taking statins increased the risk of kidney disease by 30%. Even when looking at people without underlying conditions separately, the risk of chronic kidney disease increased by 53%. Diabetes and kidney disease may be the primary reasons that statins may not reduce the risk of all-cause mortality. The fourth side effect is that it depletes your energy and makes you fatigued. It is also associated with the first adverse effect, muscle pain, and the same mechanism is depletion of coenzyme Q10, which prevents mitochondria from functioning properly. In addition, statins inhibit the formation of mevalonic acid via blocking HMG-CoA. Mevalonic acid is essential for cell proliferation and energy synthesis. Thus, statins can make it difficult to live a vibrant life. So, if you feel lost without a stressful situation or change in your sleeping habits, it is worth considering the side effects of statins. Moreover, it should also be highlighted that women and the elderly experience a greater reduction in energy. Let us now summarize. Statins have 4 significant adverse effects. It takes energy and produces vitamin shortages, resulting in muscle soreness and exhaustion. This lowers one's quality of life. Diabetes, as well as kidney disease, this is relevant not only to quality of life, but also to life itself. So, even if statins significantly reduce the risk of moderate cardiovascular disease, they did not cut the overall risk of mortality. For example, to further reduce cholesterol, 60,000 patients hospitalized with myocardial infarction in the United States were given high-dose statins. Consider the percentage of patients who take more than 80% of their recommended prescriptions. After 6 months, 4 out of every 10 people complied. Oh, I can't take it. 6 out of 10 persons stopped taking their medicine after 2 years.
Oh no!
There could be a variety of reasons, but the likelihood is that they were unable to consume it due to side effects. Previously, I stated that the scope of statin application should be reduced rather than increased. One of the main reasons is the possibility of side effects. Prescription of statins should be moderated. We'll wrap up with 5 videos concerning LDL. The next time, it'll be HDL cholesterol. I'll explain whether the more you raise, the better, and what you need to do to correctly raise it. I will reward you with better videos if you subscribe and like. Saludos!